She's not running for president, but you might say her Medicare for All bill is. This week on Firing Line.
Is this a bold and ambitious plan? Damn straight it is.
In her second term in the House of Representatives, Congresswoman Pramila Jayapal has introduced Medicare for All legislation that would dramatically overhaul health care in America.
If we can end slavery, if we can give women the right to vote, if we can send a man to the moon, then God, we can do universal health care for every American.
In conjunction with Bernie Sanders' Senate version of the bill,
our job is to lead the world on health care, not to be woefully behind every other major country.
Everyone would be covered and everyone would be affected. No more copays, no more premiums, and no more private insurance. The idea is catching fire on the campaign trail.
We need to have Medicare for all.
Medicare for all.
I support Medicare for all.
Medicare for all.
He should put billions of dollars toward Medicare for all.
But are some candidates rallying behind the catchy slogan without really embracing the policy?
Who here would abolish their private health insurance in favor of a government-run plan? Just a show of hands to start out with.
What does Representative Pramila Jayapal say now?
Firing Line with Margaret Hoover is made possible by the Margaret and Daniel Loeb Foundation. Additional funding is provided by corporate funding is provided by Stevens, Inc.
Representative Pramila Jayapal, welcome to Firing Line.
Thank you, Margaret. I'm so happy to be here.
It's a delight to have you here. You are now in your second term in the House of Representatives representing Washington's 7th District.
Correct.
And I'm delighted you're here today so that we can talk about one of your key issues, which is Medicare for All. And it is also an idea that almost every single Democratic candidate is rallying around and claiming to be part of, although to varying degrees.
Yes, correct. That is a very accurate description.
So I want to talk about that, but first, in an issue that is fraught with distinctions and differences and entrenched interests, it seems to me that the first point of agreement, and maybe the only point of agreement, is that the status quo to almost everyone involved is insufficient.
That's absolutely right. I mean, I think if you look at our healthcare system in the country today, you have 70 million people who are either uninsured or underinsured. And then you have tens of millions more who simply cannot afford healthcare. People who are using GoFundMe as their insurance plan. And it is a crisis in this country. And I think it's one that every single working family across the country is dealing with in some way, shape, or form.
Do you sense that as you begin to look for reforms, especially on the Democratic side, but across the universe of stakeholders in the healthcare environment, that most people believe that there is a way to reform the healthcare system and are coming to the table in good faith?
I do think that. I mean, it started with the Affordable Care Act. I think the Affordable Care Act covered tens of millions of more Americans across the country and actually made it so that Americans started to think, wait a second, healthcare is a right and not a privilege.
Since you mentioned the Affordable Care Act, let me just play a clip of President Obama talking about the Affordable Care Act, because it is shocking to think that it was just 10 years ago that Democrats were pushing a major reform to health care that is quite different than Medicare for All. Let's take a listen.
Today, after over a year of debate, today, after all the votes have been tallied, health insurance reform becomes law in the United States of America.
So that was only 10 years ago. But the Affordable Care Act has really fallen out of popularity in parts of the Democratic Party. Is that fair?
No, I think it's not that it fell out of popularity. I think it is that the Affordable Care Act was the first step. But the problem is it didn't actually reform the whole system. So it expanded healthcare for tens of millions of Americans, but did not and was not trying to be, I would say in fairness, a system that covered everybody.
Do you believe that the system actually can be reformed, or do you believe it has to fundamentally be changed? I mean, because I think
to me, those two things are the same. You know, it can be reformed and it has to fundamentally be changed. We pay almost double the healthcare costs of any industrialized country. But in fact, the United States today has the worst maternal mortality rates, the worst infant mortality rates, the worst rates of life expectancy of any peer country in the world.
To be fair, there are a lot of reasons life expectancy is low, right? Life expectancy is low because we have a lot of shootings, because we have a lot of car crashes, because we have an obesity crisis. Sometimes that's not due directly to
most of it is, though. I mean,
healthcare.
most of the studies show that the United States is, you're absolutely right, there's lots of reasons for low life expectancy, but when you think about infant mortality and maternal mortality, those are some of the biggest reasons that you have low life expectancy, you have issues with diabetes, you have all these other health crises that people are facing. And so it's pretty clear when you look at the statistics, and I did public health for 10 years before doing all of this work, that the United States does not have a healthcare system that provides healthcare for everybody and doesn't do it at the points when it should. I mean, this isn't a new idea. It's not a radical idea. It is actually what Teddy Roosevelt, Harry Truman, Lyndon Johnson, all of them actually tried to get to that place. But at the time, the systems that were put in place, whether it was Medicare or Medicaid, those weren't creating the same amount of profit that they are today.
I mean, Medicare for All, again, wasn't a catchphrase. It wasn't something everybody was running on until rather recently. So when was the first time you heard Medicare for All?
I would say Bernie really popularized Medicare for All back in 2015. He used to talk about it all the time. It was part of his campaign. Yeah.
Let's look at a clip.
We are going to say loudly and clearly that every person in this country will have health care. We're going to do it in a cost-effective way, and that is a Medicare for All single-payer program.
Okay, so there you go. That was back in 2015, to 15, just as you said it.
Right.
But now, every single 2020 candidate has something to say about Medicare for All. Let's take a look.
Healthcare is a right. I think the best way to get there is Medicare for all.
I do believe Medicare for all is the right solution for healthcare.
I strongly believe that we need to have Medicare for all.
And we figure out how to do Medicare for all in a way that makes sure that we're going to get 100% coverage.
All right, so just for the benefit of the audience, here everybody's talking about Medicare for All. Most people know what Medicare is. Can you just explain in plain terms the difference, Medicare versus Medicare for All?
Absolutely. So Medicare for All is an expanded and improved Medicare system.
Medicare, the system which provides health care to
65
and older.
Exactly. Seniors 65 and older.
And others with disabilities.
But is somewhat limited. People love their Medicare, but they say it doesn't cover enough. So what do you get from Medicare for All? You get comprehensive care. You get medical, dental, vision, mental health, reproductive health, long-term supports and services, everything that you need to be healthy as an individual, no copays, no private insurance premiums, no deductibles. The only thing that changes in Medicare for All is who provides the insurance, if you will, right? So the government would provide a guaranteed insurance plan, but you would use the same doctors and hospitals.
So what if a doctor doesn't want to be in the system, a Medicare for All system?
Well, most doctors will want to be in it because when it's covering everybody, that is the main marketplace.
So they won't have a choice?
Probably not. I mean, this would be, doctors would be a part of it.
So in Medicare for All, which is actually a new system,
it's an expanded and improved Medicare system because we're adding people to Medicare all the time. There's no reason to not.
But this would put
expand
in
it.
who?
This would be everybody. So everybody would be covered. Everybody in and nobody out is the phrase we use.
Okay. So would it mean the elimination of private insurance?
So what it would mean is that just like Medicare, you wouldn't be able to offer a private insurance plan that covers the same services and benefits that are covered under this plan. But if private insurance wanted to exist and cover something that isn't covered by this plan, they would be free to do that. That is how Medicare Advantage came up.
No, but I thought you just said everything will be covered.
Not everything, but
what kind of things wouldn't be covered?
Well, you know, cosmetic surgery probably wouldn't be covered. There would be certain other things, but it would be a limited.
So private insurance wouldn't be able to compete with the offerings of the government.
Exactly, which is the case now with Medicare. It's just that Medicare is a narrower set of benefits right now. Medicare for All would be an expanded set of benefits. In the end, it is cheaper for everybody to actually go to see the doctor when you first get sick versus to wait until the very end. And that's separate from the moral imperative to actually provide health care for everyone.
So as you know, there are about approximations of between 150 million to 180 million people who are currently on employer-based private insurance.
Right.
Would they lose their insurance?
Well, they wouldn't lose.
By the way, 71% or so are happy with that insurance.
Right, absolutely. And they would
What happens to them?
So they would be covered by the guaranteed insurance plan that the government would be providing. All it is we're cutting out the insurance companies that are providing the insurance, but you get to see the same doctors and hospitals.
But here's the question I have, because private insurance, ultimately, as you know, in the healthcare system, it's actually paid for through reimbursements. And Medicare is billed at a lower rate, and private insurance is billed at a higher rate.
Right.
And if private insurance no longer exists,
Right.
and is not able to overpay for services,
Right.
will there be as much money in the system to provide as many services to the population of Americans?
It's such a great question. So what we would do in our plan is we would actually have a reimbursement rate that is somewhere between Medicare and what's called an all-payer rate. So the rate would at least be as much as Medicare and perhaps more. Are there some people who are going to make less money? Well, certainly the insurance CEOs will make less money. Some of the specialty doctors at the very top of the scale may make a little bit less, but the majority of doctors, and we have incredible support from the physicians, because they are tired of spending 30% of their time on administrative costs, trying to convince insurance companies that they actually should provide the payment for treatment that the doctors know their patients need.
In the first round of presidential debates,
Right.
over 2 nights of debates, only 4 candidates have raised their hand for your version of Medicare for All, the one that would eliminate private insurance and do what your bill outlines.
Right.
So this question about whether you keep private insurance or not is a debate in the Democratic Party. Let's roll the clip of de Blasio and O'Rourke.
Would you replace private insurance?
No, I think the choice is fundamental to our ability to get everybody care for.
Private insurance is not working for tens of millions of Americans. When you talk about the co-pays, the deductibles, the premiums, the out-of-pocket expenses, it's not working.
That's right. So for those for
system that's
whom
not
it's not working, they can choose Medicare. For the culinary workers in Nevada who I listen to, who negotiated for those plans, they're able to keep them.
Why are you defending private insurance?
All right, and then what happened after that is you had Representative Delaney say, the problem here is that we're throwing the baby out with the bathwater, right? That if you keep private insurance, if people like it, let them keep it. And then why not provide for those who don't have the ability or the opportunity to buy into private insurance, a Medicare for All?
The average family who's buying insurance on the marketplace or is covered by employer insurance is paying anywhere from $18,000 to $20,000 a year in those costs. So what's happening is the private insurance companies are raising premiums even on employers. So employers either have to cover that cost on their own or they have to push it down to their employees. Employer healthcare, sure, a lot of people like it, but there are a lot of people that are absorbing enormous amounts of costs. And it's not just employees, it's also employers, which is why we have this great coalition of small businesses, medium-sized businesses, and even now larger businesses who are saying we cannot be competitive. Warren Buffett called healthcare, I think he called it the tapeworm of economic competitiveness, if I have that right. Basically what he's saying is it is killing our balance sheet.
I mean, this is certainly one of the areas where all of us agree that it is too expensive and there are ways to reform it. I think there are different competing ideas about how to reform it. I mean, there are models within Medicare itself that have proven successful at bending the cost curve. If you look at Medicare Part D, for example, it has kept prescription drug prices lower than it would have otherwise. The same is true for Medicare Advantage.
But here's the thing about Medicare Advantage. It's an enormously expensive program. People like it because wouldn't you want to have vision and hearing aids and dental? That is really important as you become older. I mean, it's important anytime, but certainly when you become older. But you're paying all these multiple plans. People are tired of having to pay for 5 different insurance plans.
But that is what's kept the cost from growing because there's competition between these multiple plans, isn't it?
If you have a large enough system, you can negotiate a far lower rate. Americans should not be paying double the cost of prescription drugs than they do in Canada. I mean, this is ridiculous. And the insurance companies can find another way to make money. God bless them. Find the other way, but don't make it off of the profits of people who desperately need health care so that they can exist and live and have a decent life.
The only thing I feel like I can't let you get away with is just saying that, you know, the profit motive has generated benefits to the system as well in terms of innovation and
What
in terms
innovation?
of all of the
what
innovation in
innovation are we
medicals. I mean, think about how in the United States we are leading in immunotherapies and in gene therapies. Immunotherapy, the thing that has kept Jemmy Carter alive. And that is because of the profit motive of biopharmaceutical companies.
But okay, most of those technologies were actually funded by government research, and there is lots.
Over $70 billion a year into research and development.
Well, sure,
that is
but
a huge amount of money.
I mean, we
and
would
if
negotiate.
it prices drugs, then how you hear the saying that today's medicines pay for tomorrow's research?
Well, we should talk about pharmaceutical drugs and research as a whole separate topic.
I know.
But
we need another 30 minutes.
But I will tell you that a lot, and I've spent a lot of time looking at this, there are lots of research and innovation opportunities, including the federal government continuing to provide some of that key funding, even more perhaps, for pharmaceutical drugs. But that's a different, that has nothing to do with Medicare for All. Healthcare is a basic human right. That is what I fundamentally believe. And these basic human rights should be provided by the government.
I'd like to talk about whether it's a basic human right. I mean, when one thinks about rights, when I think about fundamental rights, I think about the Bill of Rights. I think about the fact that we have the freedom of speech. We have the freedom to practice our religion. We have the freedom to peaceably assemble. These are all fundamental freedoms that we've agreed in this country exist for us to protect us from government overreach. When I think about healthcare, I think of it's a service that somebody purchases and is provided. How is a service that is provided to somebody a fundamental right in the way that freedom of speech is a fundamental right?
Right. If you get sick, you have no access to any of the other rights. This is a fundamental piece of who we are as human beings. You have to be able to access health care in a way that is affordable and doesn't drive you into bankruptcy.
So is that a responsibility of a civilized post-industrial country, or is it a fundamental right? And I think I would be happy to pay more so that people don't fall through the cracks, so that they have basic health care.
Right.
And I think of that as a responsibility of a civilized society that is caring and compassionate and post-industrial.
That's because
but not a fundamental right, because when you call it a fundamental right, doesn't that then imply that there's a moral responsibility and imperative for the government to pay?
If you want to call it a responsibility and I want to call it a right, the end goal is the same. And we could argue about that, and I do believe it's a right, but I also believe that it's fine if you think it's a responsibility. The reality is neither one of us is getting our needs met with this system. 70 million people in the richest country in the world cannot access healthcare.
So let's talk about the cost. The major factor here, the elephant in the room that we haven't discussed yet, is cost.
Right.
Cost to the system, cost to the economy overall, and cost to the individual.
Yep.
The cost overall has been estimated roughly by right-wing think tanks and left-wing think tanks, roughly at $32 trillion.
Over 10 years.
Over 10 years.
So $3.2 trillion a year. And that's the Koch brothers estimate, but let's take that as the estimate. I'm just going to accept that estimate, 32 trillion over 10 years. 2/3 of the cost of our current system is already paid for by the federal government. Why? Because it's Medicare, Medicaid, and public subsidies. Then you just need to come up with a little less than $1 trillion in funds that the federal government is not already paying. The employer industry is paying about $700 billion a year in costs, but they're paying it to private insurance companies, not to the government. So many of the businesses I've talked to have said, God, please take health insurance off of my books. I will pay even a portion of that to the government to cover that and to cover the cost of health insurance. By the way, health insurance that people could have no matter what job they have. A big part of that would go to the federal government, and then you got to come up with, depending on how you look at the costs, anywhere from $300 to $400 billion a year, which would be a cinch to do with a financial transaction tax on the wealthiest, a tiny capital gains tax. There are all kinds of ways to come up with that money very easily.
So explain to me, one analysis said that you could doubling all currently projected federal, individual, and corporate income tax collections would actually be insufficient to finance the added federal cost of the plan.
I don't know what study that is, but a
It's
lot
a Mercatus Institute study.
Well, I mean,
it's a libertarian think tank, right?
But also they're not looking at the current costs. So they're saying
they're saying
sort of
all the federal costs.
Right. I mean, they're saying that this is a new cost, and what I want to make sure people understand is we are already paying this money. The federal government is already paying 2/3 of the healthcare costs in this country. You could cut administrative waste out of the system immediately and save a tremendous amount of money on overall healthcare costs.
I have heard, though, there is a fallacy with this idea that the government would be more efficient, that somehow all of this would be administered in a very streamlined way, because it is administered through different departments. And so it is hard to get a cost of how this administration will work.
No,
it would be administered through HHS. It would be administered through the IRS. It would be administered through so many different agencies that it isn't just one.
Medicare is the closest example to that. I mean, you can look at the Medicare system, which the government administers today, and the cost of just pure Medicare is 2%. The idea that government can't do this efficiently is just not borne out by experience.
And so then ultimately you would raise taxes in some way on the wealthy or on corporations or on individuals to pay for that delta.
For the final delta, yeah, you could make any number of small tax increases on the very wealthiest. A financial transactions tax would bring you way more money than you need. But most importantly, what you get for it is the average family would probably pay 14% less in total costs, because the costs of the healthcare system out of pocket are getting absolutely unaffordable, and they're breaking American families.
This program was hosted originally by William F. Buckley Jr. You won't be surprised that in 1974 he debated specifically this issue.
Oh.
He didn't call it Medicare for All, but it was a debate with Max Fine, a member of JFK's Medicare task force, about government-run national health care insurance program. Let's take a look.
Okay.
We know that in England you've got to wait sometimes 7 or 8 months to enter a hospital. We know that a doctor makes only $14,500 a year. We know that he has up to 2,500 patients that he has to look after. Aren't you really indulging less a knowledge of medical needs than the old-fashioned liberal superstition?
No, not at all.
That the government is going to solve everything?
In the first place, again, we're not talking about a program like England's. However, the people of England like the National Health Service, but that is not what we're talking about. We're talking about a Social Security program.
The point is we ought to be able to learn from other people's
Well, I think the quality of care in England is very good.
The fact that they like it is just immaterial.
I mean, what about the question of wait times?
I think that England is a different system, right? England is a system where the government actually controls the hospitals and the doctors. It is a national health service. Canada is not that. Germany is not that. There are a lot of places that have a system where the insurance is provided by the government, but the actual system is privately
I've heard you say that the system of Medicare for All would be most like the Canadian system. Is that accurate?
I think that's probably the most similar.
Well, it's true, though, in Canada that there are pretty extraordinary wait times for many, many services.
Right. In general, if you look at Canada, Germany, Germany's slightly different to, some of the other European countries, you find that people don't have enormous wait times that are, that
So you're
that
saying
exist.
there wouldn't be wait times if we switch over to a Medicare for All system?
There is a sense in the United States that, you have to go and you have to get something immediately, right? Half the time you go and you find out that there's something going on and somebody says, okay, you have to go get an MRI today. Might you have to wait a day to get your MRI? Maybe. The reality is today, people are not getting care. You want to talk about wait times? Let's talk about the fact that 70 million people don't get care across the country. That's a pretty significant wait time for everybody that can never access health care in this country.
Except that there are people that don't have the wait times. And so the question is, how do you...
The wealthiest people today in this country...
the 150 million people that have private employer-provided health insurance, they have very few wait times. I mean, it really is not a feature in our system.
The vast majority of people who get health care, of the highest quality whenever they want it, as much of it as they want, are the wealthiest. And I think we have to put ourselves in the place of reimagining a country where everyone can get the care that they need.
Even if it means waiting a little bit longer.
You might have to wait a little bit longer, but I think you will ultimately get the care you need. You have to reference it to the system we have now. What about the enormous number of people across the country that cannot get care? It's not about wait times, they're dying. They're dying. I mean,
so what you're saying is to take up a little, to cover everybody, if some people have to wait a little bit longer, it's going to be worth it. That's the cost you have to pay as a society.
If it's even true, but sure, yeah.
How realistic, how achievable do you believe your version of Medicare for All is?
It is so achievable. I mean,
how politically possible is it?
Oh, look, politics is the art of the possible. And our job is to push the boundaries of what's possible. When people said, let's go to the moon, people said it wasn't possible. When people said, let's give women the right to vote, people said it wasn't possible. If we listened to people who say things weren't possible, we would never be the country we are. It requires some courage to take on the system that is profiting a very few today and leaving so many Americans without this critical health care that they deserve. It's a right. Let's give health care to everybody.
Pramila Jayapal, thank you for coming to Firing Line.
Thank you. Great to talk to you.
Firing Line with Margaret Hoover is made possible by the Margaret and Daniel Loeb Foundation. Additional funding is provided by corporate funding is provided by Stevens, Inc.
You're watching PBS.